I want to focus a bit, if I could, on African American experience in healthcare in the United States. Here's a very interesting thing. Look at the difference in life expectancies, white versus black. Across the US, it's about a 4-year difference, and I was hoping I would find out that in California it was better, but I didn't. It's actually worse in California. And it turns out that what do people die of? What is it? What are the causes of death that accelerate that shorten the life expectancy? What is it? And it turns out that some of it, of course, because of the demographics of our nation, is from homicide and violent issues. But it turns out that's actually the smallest piece of the difference. The rest of it is heart disease, cancer, strokes, and all that. In other words, almost all of that 4 to 5 year difference in life expectancy between African Americans and white Americans, almost all of that is stuff that we can treat, stuff that we know how to largely prevent, and we can treat, you know. But so what's up with that? Is it getting better? So it turns out African American men, I don't have by gender data, but African American men have had improvements in life expectancy in the last several years, so it's getting better, right? Turns out white men have also had improvements. But the really interesting thing is if you look around the world and look at look at black men elsewhere in the world, they actually track white men here. So this isn't genetic, as some people would want us to believe. This is entirely based on either the experience of being in America or on health insurance differences. It turns out your insurance varies with your race. It turns out African Americans and white Americans don't generally, as a population, get the same insurance. We don't. So non-elderly underinsured, much more likely for blacks in America to be uninsured. And the same is true in California, although not quite as much. So that's peculiar, or maybe it's not. So what happens if you control for insurance? Which of course is leading me to one of the arguments for Medicare for all, is the impact it has on the manifestations of some of the social determinants of health. What happens if you control for insurance? So we know that African Americans are more likely to die after a heart attack and more likely to get a heart attack. We know that. It turns out that if you look at it, it's about 31% more likely. And if you control for insurance, it turns out that almost disappears. If you look at African Americans and white Americans that have the same insurance, just showed you that we don't, but that have the same insurance, most of that difference disappears. It turns out on dialysis, African Americans live longer than white Americans on dialysis. And again, once you get onto dialysis, we all have the same insurance, Medicare. Control for insurance and the life expectancy doesn't just disappear, it actually reverses in dialysis patients. Same thing in the VA. African Americans in the VA live longer than white Americans using the VA. And it turns out as we age into Medicare, that huge difference in life expectancy actually quickly attenuates too. So, of course, single-payer Medicare for all is not going to put an end to the racism that's rampant in our country, but it will make a difference on the differences, on one of the more important ways, in my mind, that it shows up, differences in life expectancy.